Welcome to the Daily News Network, and today you're on a mission with Jack Sears, where we visit with local leaders of business and nonprofits, and we explore their mission and how they're bringing that into reality. Joining us on the show today with NIO Consulting Group is Dr. Nina Nejmeh. Welcome to the show, Doctor.
Thank you, Jack. Thank you for having me. I'm excited to be here.
Yeah, so tell us about your organization.
Sure. Well, it's very fitting for the on a mission part. A group of doctors and I decided to, our mission was to improve healthcare in Canada and the US. And whether it's healthcare delivery to the patient or maybe even equipping hospitals and clinics with the most innovative medical equipment or devices. We just basically wanted to give the American and the Canadian patient a better experience and a better outcome.
Yeah. So how long have you folks been doing this work?
Since 2018.
Okay, all right. Well, you got a few years. How's it going?
Oh, it's going wonderfully. We are engaging with many healthcare providers, whether they are running their clinics solo, they're very small, or a very large organization or a franchise. We're also engaging with hospitals, like I said. There are so many services that we offer for the care givers, care providers. We're the only company that I can think of or know of that helps hospitals and clinicians and all of these wonderful organizations to run more efficiently and have not only the profits, coming in, but also to have a great environment for the patients and be equipped with the most innovative technologies. And then on the other side of it, we also help patients. For example, if they wanted a second opinion on a diagnosis they're struggling with, or maybe it could be that they're having access issues to certain treatments or certain diagnostics, so they can call us. So it's a one-stop shop for both the patient and the care providers.
Wow, that is awesome. Navigating the medical climate nowadays can be very cumbersome, difficult. Lots of acronyms, lots of processes, a lot of automated phone calls. Oh my gosh. So I can only imagine that your mission is really much needed.
Oh yes, we hear this all the time, every day, whether it's a billing issue, an insurance issue, a coding issue, even training your staff at the clinic, or having maybe a retention campaign deployed, because your employees are your assets. So there's so many different layers to giving a good quality care that we basically help at every level. And for the patients, whatever it could be that they have a fear of going into an MRI that is closed. We connect them with locations that have open MRIs or whatever it is that they need. The biggest thing that we've launched recently is more about connecting patients with the right organization and also giving the organizations the latest innovative medical equipment, such as MRIs, CT scans, medical devices, and supplies.
Wow, that's awesome. That's awesome. So I mean, this is a good lead into to the final question with the time that we have. How would those listening in, how would they connect with you? How would they learn more about your services? Where would they go?
Sure. They can go to neocg.com, the website. There's a lot of information there. They can call our 1-800 number. We're also on LinkedIn and all the social media with the same name, NIO Consulting Group. Our doctors are always available, and our professionals. whether they're financial professionals or anybody else, they're ready to help with at whatever capacity is needed.
Perfect. Well, thank you for joining us today.
Thank you for having me.
Yeah.
Thank you.
Well, that's it, folks. That's the time we've had here today. And you've been on a mission with Jack Sears. Hopefully you've learned something new. Perhaps you'd like to connect with Dr. Nejmeh. Well, if so, you'll want to revisit this interview and maybe even share it with somebody else by going to thedailynewsnetwork.com. Until we get together next time, here's wishing you good health, much happiness, and remember, treat each other the way you'd like to be treated.